Welcome, everyone. Thank you for joining our webinar tonight. We're very excited to talk about IVF at Ovom Care, how to turn failed cycles into success stories. Tonight, you'll learn about how IVF works at Ovom Care with Dr. Lynae Brayboy, our co-founder and chief medical officer. You'll then be able to meet our expert panel of doctors, Dr. Joaquim Nunes and Dr. Renato Martins, as well as Seetal Savla, our fertility advocate of the night, as well as Stephanie Marshall, our former Ovom Care patients. And you'll also be able to hear real patient stories, as well as ask any questions you may have at the end. So without further ado, I'd like to pass the mic over to Dr. Lynae Brayboy, who will let you know everything about Ovom Care and IVF. Over to you.
Thank you so much, Leslie. Hi, everyone. Thank you for joining us. And so we're going to talk a little bit about IVF and a little bit about Ovum. So if you're joining from home, I think Leslie usually gives this disclaimer, but this does not replace the advice of a doctor. This is not medical advice. This is not information about your personal treatment. It's an overview and also testimonies from people who've been through the process. So what is Ovum? We're a hybrid IVF clinic. We combine not only world-leading experts like my colleagues, Dr. Joaquim and Dr. Renato, but also technology and research, which is very unique to an IVF clinic. And our key differentiators are that we provide a superior patient experience. We try to really be with our patients at every step all along the way. And what we also attempt to do is to make sure that all of our care is financially accessible. And we're industry leaders when it comes to success chances because not only of our technology, but also our experienced personnel. So we are opening our flagship clinic in Portugal, right outside of Lisbon, in a town called Cascais, which is almost the French Riviera of Portugal. And we invite you to come to our clinic. And I want you to also know about our medical team. So I'm the chief medical officer and co-founder, and we have a senior fertility nurse, Vanda Costa, Ahmed Ahmer, who's the VP of clinic development and also is an embryologist, Dr. Renato, who's on the call here, and also Dr. Joaquim. And you'll hear from them later in the talk. So why Ovum? One, we define the industry. Really, we try to provide care that is better than everyone else. We go above and beyond. And we also have a team that's world-renowned and skilled in their domain. And we do all of this at a fraction of a cost without sacrificing quality. We are trying to make sure that you have access to the most advanced fertility technology, and we guide you every step of the way. And we do this in an environment in Portugal that is scenic and relaxing. So it's almost like a fertility retreat. And so let's talk about why you would choose Portugal. Well, besides its beauty, its history, and its ease to get to, it's a world-class healthcare destination, and it's a calm environment. All of our doctors speak English. You'll find that out in just a second, as well as our nurses, so that you really can leave the stress behind at home and have care, almost like a vacation with care, and enjoy yourself while you're getting pregnant. And so our clinic is located in Cascais, which there's only a 10-minute walk to the beach. We also have partners with hotels in the nearby area. So we have a resort across the street and then a Sheraton down the street that we have negotiated rates for our patients. And again, this is to make sure that in a time that is usually stressful, that this can be a getaway, almost a fertility moon or destination IVF. And the benefit of cycling with Ovum is that compared to the UK and the US, we are 30% and 70% cheaper on average. And so here's a breakdown for those who might be tuning in from the UK. So an average cycle cost altogether is about £7,000. And when you cycle in Portugal with equal care or superior care even, in a nice environment that is stress-free, £4,850, including the flights, including hotel and accommodation. In the US, the care is often very expensive, so it can be £15,000 on average for a cycle, compared to Portugal, which is about $4,850. So a really tremendous savings for people. And as I mentioned, Lisbon is extremely well connected. So there are daily flights, multiple daily flights from London, from the US, and in major cities, there's also multiple flights, and also in Lusophone Africa. So here are some of our hotel partners. The Sheraton has negotiated rates for our Ovom patients. This is about a 5 to 7 minute walk from our clinic, down the street, literally. And this resort, which is a beautiful resort I've been to before, is right across the street. And you can see the rates are comparable to what you would perhaps pay in London for a normal hotel at a spa and resort. And we have flexible financing solutions because our mission at Ovum is that every person who wants to have IVF and wants to become a parent should be able to. And we provide IVF financing through our various partners, such as Gaia. We also have personal loans that people can take advantage of, as well as products such as Klarna and PayPal. And here, let me tell you about our app. Our app is developed with patients in mind so that you don't have to have the back and forth phone calls, which is typical of an IVF clinic, or emails. Here in your app, your entire care journey is mapped out, and your nurses and physicians will use this app to communicate with you so you can really stay in control and know what is coming next and what to do when, which is super important during an IVF cycle. And now let me orient you a bit to the journey. So it usually starts with patients having initial medical consultation. And the reason that we want you to have the initial medical consultation is that it gives the clinicians or our physicians the ability to go through all of your health history, all of your surgical history, all of your medications, and also make sure that you are optimized preconceptionally before you become pregnant. You can do this consultation either in the comfort of your home, just like we're speaking now, or you can do it in person at our clinic starting January 2025 when our clinic is opening. The diagnostics that you would do with us usually entail ovarian reserve. This is something where we check something called anti-Müllerian hormone. This is a blood test. This is a marker of how many follicles are still in your ovary or your ovarian reserve. We also do an ultrasound, and we look at your antral follicle count, and this allows us to know how many follicles are developing in this menstrual cycle. And we would also do preconception labs such as HIV, hepatitis B, hepatitis C, and syphilis in Portugal. And then we also know if you have a partner that is male who produces sperm, we will look at the quality and quantity of the sperm before we start. And then you come back for a planning visit. And this planning visit is to go over your diagnostic assessment, plan your treatment, and make informed decisions about what you want to do next. So you only have to come in for the diagnostics, or you can do the diagnostics at home if you're not in Portugal. And then you can have a remote consultation or an in-person consultation with one of our clinicians. Once you're ready to start, you have a nursing consultation. And the purpose of the nursing consultation is so that you feel comfortable injecting yourself. We have videos that are already pre-recorded going over how to give yourself the injections, but you will have a consultation either in person with Vanda or Helena, one of our nurses, or digitally. You can do that in the comfort of your home. And now let's talk about stimulation and monitoring. Once you've had your nurse consultation, your medications will be delivered to you, and you'll start injecting yourself as directed with the doses that are pre-prescribed by your clinicians. And this happens usually and typically over a 10 to 14 day period. And so you'll need to come to have some type of monitoring at least 2 to 3 times in either one of our partner clinics, or you can fully have the journey in our Portuguese clinic starting in January. Once we think that you have been stimulated enough, then what we would do is advise you to take the trigger injection. And what this does is it matures the eggs so that the eggs can actually be picked up at egg collection. And not every egg is mature, but the trigger shot ensures that hopefully the majority of the eggs will be mature. And the egg collection happens about 36 to 37 hours after you have the trigger shot. And the egg collection is only about 20 minutes, but from start to finish, it could be an hour by the time you have anesthesia, by the time the collection is done, and by the time you wake up. And on the same day, we give you immediate results about not only the number of eggs, but also potentially the quality of those eggs. And the fertilization results will also be apparent because we give you a link to a program that allows you to follow the eggs from being unfertilized to fertilized to hopefully dividing and becoming embryos, so that you have full transparency over what is happening during your IVF cycle. And if you elect to have a transfer, then you will have your embryos transferred back on day 5 as long as they're developing. And if you decide, though, that you want to do any additional testing, such as pre-implantation genetic testing, there will be a delay, as that takes about 2 weeks. Again, if you decide to do the PGT or pre-implantation genetic testing, we will store your embryos and we will wait for those results. And sometimes if you have a transfer, so if you have a transfer, you might have excess embryos. And if you do have excess embryos, what we'll do is store those embryos, those excess embryos, also in cryo storage. And they're stored in a Tomorrow robot, which is a monitored robot. And the good thing about the robot is that it's not like typical traditional storage where we used to use containers and use liquid nitrogen to store the embryos. This instead is an automated system that only allows our embryologists who are registered to use this robot. And so essentially this robot is more advanced because it is also monitored by a team in New York 24/7. And you can always request the information about the storage conditions of the robot, which is not possible with traditional storage in traditional clinics. Okay, so let's transition to the technology. So at our clinic, if you decide to freeze eggs, or you decide to freeze eggs and embryos, we do have Ovum Egg Intelligence, which allows you to know about the egg quality. We also use computer-assisted sperm selection, and this allows us to choose the best sperm, not just the sperm that is closest to the needle, but really the best sperm based on its motility and also its morphology. And here is an example of what we would do with our best selected sperm. We would do ICSI, and ICSI is intracytoplasmic sperm injection, which allows us to inject sperm into the egg. And we videotape all of our ICSI so that we know that we are using the proper technique, and we can always go back and show you the videos. And we also have embryo intelligence, where we use AI technology to help us make decisions about the best embryo to transfer. As you can see here, the embryologists are looking at different embryos, and each embryo has a score based on the time points that it had. So when did it divide? How quickly is it dividing? Has it met all of the time points that it should? And based on that, there's a score, and that score allows us to inform you about the best embryo, doing this based on data and standardization as opposed to choosing randomly the embryo. And also, the way that we do this is that we have time-lapse imaging, and you have a link again to see your embryos developing so that you're in the know, and it's not a surprise of what you'll have transferred afterwards. And again, this is another slide just to show you about the cryo storage. This is the old school. So these are canisters that are filled with liquid nitrogen, and the embryologist will freeze embryos or eggs or sperm and put them in this type of storage container. But what we do at Ovum instead is that we use a robot so that, again, it's fully automated. There's 24/7 monitoring. There's over 1 million daily checks, and you have access to this real-time information. And here's an example of the robot being loaded. So this is one of our embryologists putting actual embryos into the robot, and it's extremely secure. Our nurses don't have access to this. None of the physicians have access. Only the embryologist who is treating you on the day of your care, or when you come back if you have accessory or more than one embryo. Okay, so I want to take a moment to introduce our panel. I want everyone to come off before we go to the Q&A, and I'd like everyone to introduce themselves. I'm going to start with Seetal. Seetal is a patient advocate, a copywriter, a blogger who has been through IVF, not with Ovum, and we've invited her here today to talk about her experiences. Seetal, if you want to say hello.
Hi, good evening, everyone. Thank you very much for inviting me to be part of this panel. I'm Seetal Savla, and as Lynae said, I'm a fertility patient advocate. 5 years ago, I started sharing my fertility journey online to support others in similar situations, especially people from South Asian backgrounds where the stigma and the shame surrounding fertility issues is still so strong today. And I also wanted to use my experiences to educate people to give a real insight into the realities of undergoing IVF.
Thank you, Seetal. And we also have one of our Ovum patients, Stephanie Marshall. And Stephanie is on the call. Stephanie, would you like to introduce yourself?
Yes, hello everybody. My name is Stephanie Marshall. I underwent a medical treatment last year, so my partner and I had to very frantically look for a fertility clinic that would work with us, and we came across Ovom. So I'm really here just to give like the point of view of basically a deer caught in headlights, and going through that search, trying to find a suitable clinic that would work, with my specific situation.
Thank you, Stephanie, so much for being here. And we have also with us Dr. Renato, our medical director of Ovom Portugal.
Hello, everyone, and thank you, Lynae, and congratulations for the presentation. My name is Renato Martins, and I'm the medical director for Ovom Care Portugal, and I've been working in reproductive medicine for over a decade now.
Awesome. And Dr. Joaquim, who is our clinical director of Ovom Portugal.
Hello, everyone. My name is Joaquim Nunes. I am a Portuguese gynecologist, and I've been working with reproductive medicine for like more than 30 years now. So I'm very happy to be joining Ovum now, because we have the same type of mindset regarding the infertility patient. And so I'm here also to answer questions if there are some. So I'm happy for that.
Thank you so much, Dr. Joaquim. So I'm going to start with Seetal. And by the way, if you're tuning in, go ahead. I think Leslie already invited you to put your questions into the chat. But I'm going to start by asking Seetal, you had a very, I would say, long journey, right? And you ended up having a spontaneous pregnancy in the end. But do you want to kind of walk us through how that felt for you as a patient? And you actually took your daughter back to visit some of your clinicians who took care of you, and why that was so important and special for you.
Yeah, that's right. So my journey in total took about 6 years, involved multiple cycles, donor conception as well, and unfortunately a couple of miscarriages. And I have experience of 3 clinics. The first one was NHS, and then 2 different private clinics, all in London. And from my perspective, the best clinic was the last one, because I met the man who would go on to become my consultant at the fertility show. And from that initial meeting, I had such a good feeling. I felt that I was seen as a patient and a person, and not just a walking credit card or a statistic and an outcome at the end of a cycle. And that care and attention followed through from the first consultation. The environment was really calm and nurturing and relaxing. Like you were saying about the new clinic in Lisbon, that's how I felt. I would sometimes take my laptop and just catch up on emails while I was there for appointments and procedures, because it felt like a good place to be. Whereas in my previous clinic, for me personally, there were baby pictures all over the walls. There were gossip magazines with pregnant celebrities, and I found all of that quite triggering. Whereas at this clinic, they had art, they had lifestyle magazines or interiors. It was all very neutral and quite soothing. So I felt relaxed going into each appointment. And that was important for me. And like you said, I had such a good relationship with them over time that even though the treatment was ultimately unsuccessful, I took my daughter there to meet my consultant because I had a really good experience. And I think that's important. You need to feel comfortable with the clinic that you are with. You need to feel seen as a person, and that your journey is important to them. And another important aspect was also the research, knowing that the clinic was participating in projects, and then that knowledge and all that information would be applied, the latest tech would be applied to your treatment as well. So it was bespoke, not just a generic sort of journey.
Thank you for sharing that. Stephanie, would you like to maybe share about your journey and how you actually had to embark upon this and how you were treated in some clinics?
Hi. Yes, I think the way ours came about was, yeah, just the whole diagnosis, the medical diagnosis was it felt very sudden, very immediate. And, I think everything just really transpired really fast. So we had an initial discussion with my doctor at the time, or my nurse, I should say. And then after that, we then got referred to the fertility clinics through the NHS. So we did the three major ones, and we went through through the assessments, and everything was really rushed. But then at the end of the week, because we had like 1 or 2 weeks, we were told very abruptly that due to my BMI, I wouldn't be able to we wouldn't be able to go through the whole process on the NHS. So we would have to go about it privately. So then that was when I then took upon myself to try and find some clinics, just down the usual, I would say, Harley Street, all around. And I think my partner actually called 1 or 2 places, and it was a very general discussion, what's our situation, what's my weight, which I found it's a very cold interaction. And then in the that evening, I would say that first week, that's when I went about looking for other places, either in London or in Madrid or in Greece. And that's when I came across Ovom. And I think even though I didn't speak to you, Lynae, immediately that evening, I think the first conversation we had with you was something that I think Seetal also just mentioned now, which was very important, was how personable you were, and just how even though we were aware of the issues and what the outcomes could be, I think it was just that personalized conversation about our specific situation that really changed everything for us. Yeah.
Thank you so much for sharing, Stephanie. So, Dr. Renato, Dr. Joaquim, for patients who are embarking on IVF, how do you tell patients what to look for in a clinic? I'll let Dr. Renato start.
I think it's like in any sort of patient medical relation, there must be trust. So if the patient doesn't feel that they can trust us, we lost. It doesn't matter if you have too much technology, if you have too much expertise, if the patient doesn't trust what you're saying to them. And sometimes, especially in this area, you will have to say things that people perhaps are not ready to listen to it. And if you start from the point where you lost the patient because they don't trust you, then there's no point on moving forward, because no matter how many statistics, how many expertise you throw at them, they won't care. They won't listen to you, and they will find someone else more empathic. So the word is empathy. Just feel for the other. To put yourself in the other's shoes is what we should do all the time. It's not easy. It's not easy because we're also people, and we need to have some defense mechanisms as well. But it's being empathic.
Yeah, being able to recognize what the other person across from you is going through. And I think, Dr. Joaquim, you've been in this industry for 30 years. You've seen pretty much everything everywhere.
Yeah.
What would you tell to patients who are trying to decide about where to get care for IVF?
Well, I totally agree with what Dr. Renato said. I think you have to trust the person that's taking care of it. That happens also in other fields in medicine, right? For it to work, you have to be confident and trust the person who's treating you, right? Also, there are other factors involved, of course, because when we talk fertility treatments, we are talking about also you have to consider costs, because it costs a lot of money. So that also may have to be part of the choosing process of where to do it. It struck me that Stephanie, for instance, didn't get a chance to do her cycle in an NHS because of the BMI. That's really something for me very strange, because above all, you have to, the patient has to be informed about the impact of BMI, either extremely low or very high on success rates. But otherwise, some people cannot just change that. So how can we exclude someone from a technique, from being able to be part of the process just because of that? I don't know.
Right. So there are a lot of barriers to IVF,
Yeah.
and I'd maybe we'll do one last round and then we'll get to questions. There are questions already popping up for our panelists here. So you talked about this, you touched on this, Seetal, that as a person of a minority background, how difficult sometimes that is to access care, and why is that? What are your thoughts about that?
I think it's a subject that requires a bit of time to unpick, but from my experience, there's a lot of judgment that happens within South Asian communities as well. We're worried about what other people will think, about being ostracized from our families and our communities. So there's a lack of education, I say, because we don't talk about these issues so much. We don't necessarily know that there's something wrong. We don't know where to access help, how to access it. And so those are definitely barriers to success, I would say.
Stephanie, did you find similar experiences trying to obtain care?
To be honest with you, not really, only because we don't, I mean, in terms of like family and friends and that, it's only my partner and I, and we've got more of a close friendship circle. So I think the things that was very important to us was if the clinic was very inclusive, because I have a lot of friends that are from the LGBT plus community who are embarking on having kids right now, and I had friends that had gone through some really crazy story with another fertility clinic. So these are the things that we were kind of very worried about, and one of the reasons as to why we also went with Ovum, was the fact that when we did Google and we did get our invoice and stuff, just the imagery, of inclusivity and stuff. So that kind of resonated with us more. That I haven't really had a lot of experience because, again, this medical issue just happened. Like, it was really fast. It just happened in June, and then 2 weeks into June, we had to make some crazy decisions. So I didn't really have that experience of, going about and looking into these things or really talking to anybody about it. But yeah, it was more the other side, just to see like if it's something that we resonate with and that, that kind of like is out there for everyone. And I think that's one of the things why we liked Ovum was, as you said, making IVF accessible to everyone, So yeah.
Thank you for that. I see a hand raised, but please put your questions in the chat because we can't actually unmute people in the audience. So if you have your hand raised, just go ahead and put your question in the chat and then we'll have those answered. So we have a couple of questions already. So first question is, Stephanie, this is for you. Were there any parts of the IVF journey at Ovum that surprised you in a positive way?
I actually discussed this with my partner as well because we had to think about it, and I think not because we didn't have a previous experience, but I think for us, just of talking with the other clinics and with the array of people that we had to talk to get through, it would be the openness to the whole process. As you were saying, once you go through the stimulation, being able to, go to have a link and then go online, the thorough explanations that we had, about what was actually happening, especially for my partner, considering that at that point we didn't really have like a physical place to go to. This was 100% based on trust and our interactions with you. The fact that we had this open dialogue, there was never a silly question. So I think that surprised me. The fact that, that we could just talk and think and ask anything that we were worried about, that we were thinking about, and having that open dialogue. I think that really surprised us. And then also just the AI, like how modern it was. The fact that we could actually just, just like log in. We kind of got obsessed with it, but just logging in and just, watching them. So yeah.
Thank you, Stephanie. I see still some hands raised. Go ahead and put your questions in the chat so we can make sure to answer them. I have a question here. This is, well, I'll give this one to Dr. Joaquim or Dr. Renato. I'm interested in going to Portugal, but I don't speak Portuguese and I don't know the country. What language are medical services provided in? And Dr. Joaquim.
Yeah, you're welcome to come to Portugal. Almost everyone speaks a little bit English. Like you can see from from my English, it's not very good, but I can make myself understand, and so English is fine. Everyone speaks English here, and we are very also in terms of what, for instance, Stephanie was saying about the LGBT community and all that. Portugal is now a very inclusive country. Also, in terms of the law, the law accepts all kinds of treatments for everyone, and that makes me happy to be working here, because it's really a plus for me. And I think you'll be very welcome in Portugal, and there will be no language issues, I'm sure.
And Leslie also is based in Lisbon, and she will tell you that it's also very English speaking. Leslie, do you have any thoughts about that?
Indeed, I think Portuguese speak very well English. There's no problem at all on my side. I am learning Portuguese and everybody understands my English very well. So, and our medical team is of course English speaking as well as other languages, and there's no issue around that.
You need more classes, Leslie, still, okay?
Indeed.
Okay, we have another question. I'm from New York. Do I need a visa for medical treatment in Portugal as an American? So I'll answer that one because I'm American. So you can actually spend 90 days in the EU with no visa at all. You do not need a visa for medical care. If you are there in the EU or here in the EU more than 90 days, then you will need a visa. If you want to get a job in the EU, you need a visa, but not for medical care. So I hope that answers that question. If you're an American passport holder, you do not need a visa to get medical care. Okay, I have another question here. I'll give this one to Dr. Renato. Until what age can I have IVF? Dr. Renato in Portugal.
So there's an upper limit to do IVF in Portugal, and it's based on women's age, and it's 50. As soon as you complete 50 years of age, then you're no longer eligible to pursue any IVF treatments in Portugal. That's mandatory by law. Law is always adjusting and changing, and for the time being, that's what we have. And I think that's one of the limits that we actually have in IVF in Portugal. As Dr. Joaquim told, we are very inclusive, and we should remind everyone that we came from a dictatorship just 50 years ago, 50. So coming from there and where we are now, which is one of the most free and endorsing countries in the world, it's amazing as a Portuguese myself to be proud of that.
It's progressive, and that's actually why we chose Portugal, because in the EU landscape, it's one of the most progressive countries. Dr. Joaquim, did you want to add to that?
Yeah, please. I would add, in the age concept, I would add that 50 is the legal limit for whatever treatment, fertility treatment, even if you're using donor eggs. Because in other countries you can use donor eggs if you're older than that, but not here. Even if you're using donor eggs, 50, when you reach 50, you won't be able to do any kind of fertility treatments here.
And there's a reason for that, that 50 has been made. Dr. Joaquim, do you want to expand on why 50?
Well, it comes from the law of adoption. We already have a law for adoption, and that's also the limit for adoption. So this law came a little bit from that. Okay, so the state considers that you may be too old to become a parent after 50. And so it's the way the legislator made it here.
Okay, thank you for sharing that. So this question is for both Stephanie and Seetal. Seetal, I'll have you go first. I have a busy schedule with my job. How did you manage taking time off work and managing symptoms during the IVF process? Seetal?
I was quite lucky with my employers when I was going through IVF. I had a lot of flexibility, so I was able to take time off as and when I needed it and go into the office or work remotely if need be. I would say if that's not the case, then it would be advisable to speak to your supervisor and see if there's any flexibility there around appointments. Some appointments you can plan in advance, and obviously when it comes to the transfer, there is a degree of flexibility there. You don't always know in advance when you'll be going in, but you can give the employer some indication of most of the schedule for your IVF cycle. And I understand, because I've been quite open online and within work about what I've been going through. I know that not everybody is in that position for various reasons. If you are worried about it impacting your career prospects, for example, you're just a very private person and you don't want everyone to know what you're going through, you'd rather manage that yourself. If there is someone that you can confide in, whether that is your supervisor or a colleague, I think it is nice just to sort of have someone on your side in the event of pregnancy announcements or photos going around or baby showers. It's nice to have someone in that situation who knows what you're going through. In terms of symptoms, for me, I was okay with the medication. I think it was emotionally that I struggled the most. So I tried to build up a strong support network around me. The Trying to Conceive community on Instagram has been really supportive. I've found a lot of good friends on there that they started out online. They've translated into real life friendships beyond IVF, and it really did make me feel more empowered during my journey. Outside of that, friends and family as well. My husband and I, we're very lucky that we have supportive families. That's not always the case in South Asian communities. That's a reason why people do tend to keep things to themselves as well. The fear of just people not understanding. Sometimes you can feel like a bit of a failure. And obviously none of that is justified. It's a medical issue, what people are going through. But when you then have other people's comments and questions piling on, it can be very difficult to manage and navigate. So I would say, yeah, having support around is essential.
Stephanie?
I would say very similarly, I was working and I was able to work from home during those initial days. I didn't really feel much, to be honest, but then I also think I was in a bit of denial because I thought that I was perfectly fine until the last couple of days. I just started crying randomly and random things. So I think at that point I was like, okay, so this is actually working. Yeah. But yeah, no, I spoke to my manager and, I managed to work from home for most of the days in the week. And luckily, I think the transfer happened over a weekend, if I remember. So that was fine. I think it's slightly different for me in the sense where I never really wanted kids. I still don't really. I don't think that's changed. I think it's just more related to the medical issue that I went through, that it was like, okay, the decision's been taken away from me now, so what do I do? So this is one of the reasons as to why my partner and we went about it, because I think he initially wanted kids, but now it's like, we're not there anymore. But I think it was just having the option and the choice to go about, doing this. So we weren't really too fussed about, support in that sense of like, speaking to people or anything. I think for me, this was a good experience to really speak to my friends about, especially my LGBTQ friends, because I've got quite a few friends that have now got married and that, you know, they are thinking about embarking on this journey in a couple of years. So it was really just having that conversation with them about this and explaining to them what I'm going through, you know, the clinic that we found and how we felt, and yeah, that side of it more.
Thanks for that. Dr. Renato, did you have something you wanted to add? And I see some hands from the audience. Go ahead and put your questions in the chat because we can't unmute you, unfortunately.
Yeah, I just want to put an extra on what Seetal just said about the not the fact that sometimes it's hard to tell at work that you're doing IVF. That's another additional thing about Portugal. You're just coming for a holidays. No one needs to know that you're also doing medical treatment as well. So that's another perk of the treat.
Absolutely. And if you need to, you can also work remotely. You can do a workcation. And that's also a benefit of being in Portugal. You're not too far away. So if you're coming from the EU, from the UK, you can get right back. From the US, obviously a longer flight, but you can still work remotely. Okay, so let's get to our next question. So there's a question, is there an upper age limit for women using their own eggs in Portugal, I assume? But I think we addressed that question. So 50 is the upper age limit in Portugal.
Yeah, but still, I would add to that maybe you should be aware that if you're going through IVF and you're using your own eggs and you're 49, you have to be aware of what chances you have of success. And success is not just getting pregnant, it's having a healthy child from that treatment, okay? So you really have to know that the chances at 47, 48, 49 are somewhere lower than 10%, okay? But if you are aware of that and you still want to go through it, there is no legal constraints. You can do it, yeah.
Up until the age of 50 in Portugal. Okay, and we have another question. I'd like to start treatment with you by the end of the year. How long is the waiting time? Dr. Renato?
Oh, we already have a waiting list for Portugal treatments. So my advice is just book with us and let's have a chat and let's have a talk, because there are a few steps, as Lynae has already said. So we actually need to go through an initial medical consultation so that we check every background, everything in terms of medical records, everything that goes on with you. There's the diagnostics, which will always require quite a few time, a couple of weeks to manage that, because it's also related to your cycle. And sometimes when you do the initial medical consultation, you're not in the proper stage of a cycle to do those diagnostics. So my advice is, if you're considering doing it until the end of the year, just start putting things in motion, because even though the clinic is not open yet, all of those things we can actually start building up so that once the clinic opens in January, you're ready to go.
Absolutely. Thank you for that. There's a question I don't understand. It's directed at me. If you could rewrite the question, I think I could answer it for you. So why do you say IVF for difficult cases? If you could restate the question, I think that would be helpful, and I'll be happy to answer it. While you restate the question, someone's asking how would it work doing IVF in Portugal? So Dr. Renato, do you want to answer that question? So if you're living somewhere else, you're living in the EU, the UK, the US, how would that work?
You have all the options available. So you can do, as I said previously, you can do everything here. So you do the diagnostics and the initial medical consultation, and that can be done at home, so remotely, with our partners, so that we have the validated results, so that we can make an actual plan. As soon as we have an actual plan and we set how can we move forward, then you can do the whole stimulation here in Portugal and the egg retrieval and the IVF, and that will take you around 2 to 3 weeks. So it's going to be a very nice vacation in Portugal, and you can enjoy the majority of the country, because we're not a very big country. And the majority of times you just come for a very quick scan and consultation to give you feedback on how you're stimulating. And after that, off you go, and you can just travel to another city in Portugal. So you don't need to stay in Lisbon for the whole time. Yes, I know Joaquim is from Lisbon and he loves Lisbon, but there's the rest of the country, which is also very nice and very good to travel to, and very
Can you
close.
tell Renato is from the north?
Yes, obviously.
So Porto is like 2 hours on a train, right?
Yes,
From
and the
Lisbon.
trains are speedy, fast, nice, luxurious, and very cheap. So it would be a very cheap vacation. Also, there's the other option where you can actually, for instance, if you say, oh, but I don't have that much of a time. I don't want to spend my whole vacation of this year doing IVF and traveling to Portugal. That's okay. You can do the majority of the stimulation and monitoring
Yeah.
also in your country with our partners, depending on where you're coming from. And then you just come for the egg retrieval and the IVF and the transfer, the embryo transfer. And that will only take you around a week. If you're just considering doing, for instance, egg freezing for preservation of fertility, then it's a smaller amount of time and you don't actually need to spend as long as here in Portugal. So it's up to you. But I think that a week's vacation everyone has. And even during 1 week of vacation in Portugal, you will just have a glimpse of the wonders that are expecting you. So you have all of these options, depending on how much time you actually are able to afford and to spend here.
Awesome. Okay, we have another question. What makes Ovum distinct from other fertility clinics, especially for women of advanced maternal age? So I think that question is directed at me. So Ovum does not discriminate, okay? Ovom Care is about making sure that everybody who wants to become a parent can. And many clinics have age cutoffs that are arbitrary, that are not personalized. And what we do is try to tell you what your success rates would be with our IVF success calculator. So we use your diagnostics, your AMH, your antral follicle count in the future, and also if you have a partner, your partner semen analyses. We go through that and we put all of that into a calculator to give you the best estimate of what your chances would be. And that way, before you go into IVF, before you have perhaps a non-successful or live birth with an outcome, that you know what your chances are. So you can decide if you want to have alternative plans to become a parent. So that means before you do IVF, you could look at actually your chances if you'd used egg donation. Before you do IVF, you could look at your chances if you decided to go to, your first round, your second round, or your third round. And this is important because patients need to know what they're getting into up front. And oftentimes, patients only find out after they've been through multiple cycles. So that's number one. We don't discriminate based on age. We give you personalized advice based on you, not based on your age. The second thing about Ovum that makes us distinct is that we do research to understand ovarian aging. So right now we have a collaboration with Lynae to understand ovarian aging because we don't have enough information in the field. So the best marker that we have of how you'll do in terms of your stimulation is your ovarian reserve marker, your AMH and your antral follicle count. But there could be much more to the ovary to understand. And glycans, which are a part of what we call inflammaging or aging and inflammation that we have, is a way to look at that. And so no one has looked at that in ovarian aging. And so that's what we are attempting to do with our R&D, our research and development. So that's the major way. Okay, so I think we have another question. Anyone else want to comment on how Ovum is different for people of advanced maternal age? Okay, the next question is, what is meant by the title? So IVF for difficult cases. I think in many times when people go through IVF, they are told, you don't fit the criteria and therefore you are excluded. And so that's why we invited our panelists to talk about their experiences. And, sometimes in IVF, you're not successful. But what's important is the journey. That you understand what's happening along the journey, and that transparency is what we provide at Ovum. So that transparency allows you to have the empowerment to make decisions based on your care about what to do. And I think this is what I wanted to express, and the title is really about understanding everyone individually and not lumping people into just one group or another and saying, you won't be able to become pregnant. We don't know. We always give personalized care based on the person that's sitting in front of us. I hope that answers your question. Okay, I'm just looking at the time and making sure we've answered everyone's questions. Oh, here's one. I'm considering IVF, but I'm quite scared to make the first step. Any advice, Seetal and Stephanie? Stephanie, do you want to start?
To be honest, I don't really have advice on like the step. It's really just, following your instinct. And I think especially with us, when again, it was very different. I mean, now there's a clinic in London, you guys are in Portugal. I think initially, for anybody who goes into it, and they're not sure, is to follow your gut and to have that first assessment or that first conversation, because that will really tell you and it'll guide your decision as to what to do next. Again, like when I just on what you said, Lynae, when we had our first consultation with the clinic that was working with us when we went through our journey, when we spoke to the I guess he was the specialist, when we spoke to him, of course we are aware of the risks. We knew going in, that I might have a low follicle count. All of these things were apparent, but again, it was that conversation. It was that pessimistic point of view on what's going to happen, about that we shouldn't get our hopes up, that chances are it's going to be low, that this is going to be negative, and all of that impacts your decision. So in that moment, I spoke to my partner and we were like, okay, so obviously, even if Ovum wasn't there, we were not going to go with them just purely based on that, so it's follow your gut. I would tell anybody that, and just to speak openly and honestly, and if you don't get that reassurance, if you don't get that feedback, walk away, because ultimately it is a massive toll that is taken on you and your mental health and your body. And I think it's that's what I would say.
Seetal?
I would echo what Stephanie said, actually. When I started out on my first cycle, I was petrified. I was really overwhelmed and didn't really take the time to do a lot of research. I just sort of turned up where I was told to be, where and when, and everything happened to me. After I'd done a couple of cycles, I felt a bit more familiar with the process. I went along to the fertility show as well, and I was able to speak to different clinics. I felt more empowered to make an informed decision, more in control than before. And that's how I found my third and favorite clinic. And I felt really comfortable there with the team and with the services that they were offering. And IVF, as Stephanie said, it's a massive undertaking on every level, financially, emotionally, mentally, and physically. And so I would advise to take some time out just to really read up and find out on what's involved. Don't be afraid to ask questions as well. You can do free consultations and get a feel for the place, for the team. And if you don't get a good feeling, definitely walk away and find somewhere that's a better fit. A good clinic will be happy to answer your questions and settle all those fears and concerns that you have.
Can I add something? I would say that talking to patients also before starting, talk to other patients that have been through the process, and because either if they were successful or not, but they can give you that insight that we as technicians are always seen as differently. So talk to other patients, and that will help for sure.
No, I would add to that no two journeys are the same. Of course, we all have our individual stories, but it definitely helps to get an insight into what is involved. And yeah, you will find people that you relate to a bit better, stories that resonate more with your own, especially in the case of like myself, South Asian communities. It does help because that's a different layer. You have different cultural challenges to take into account.
Stephanie?
Oh, sorry. I just wanted to add, just very briefly, something that you actually did in the first couple of weeks when we spoke to you, was when we were very anxious about, because in that moment, and I'm sure Seetal can echo this, but in that moment when you're going through this, it's like you feel very isolated, because we went from like this one way of, in our bubble, in our environment, in our world, and all of a sudden it was like, yeah, you go, you have to deal with all of this. And when we initially spoke to you, Lynae, we were very anxious, and we were like, well, let's find reviews, let's look for people, let's find somebody. And something that you did amazingly was that you actually sent us links of people. I don't know if you remember initially, the people that we could we could contact and that we could speak to, because we were like, okay, is this a scam? Is it real? Like, we don't know. Like, we need to find people. And I think, as Dr. I'm going to mispronounce this, Dr. Joaquim said, it's important to like find other people as well, and and speak to patients that are going through this. No, that's
Yes, I actually had forgotten I sent those links, but yeah, that's the point, is that it's hard to do things on your own, and sometimes things can not work out the way you want to, and it's important to have someone to talk to, and to vent your frustration and anxiety. And at Ovum, what we try to do is have more, I would say, touch points with you through our app. You can always book with us. You can have a pre-consultation to talk with Dr. Joaquim or Dr. Renato to get your questions answered, so you're not feeling like you're going into something without having full information and full visibility. So we have a couple more minutes. I think those are all of the questions. If you have any last questions, this is the time to go ahead and put them in the chat. But Seetal, looking back, what's, again, like the one thing you wish you had known going into IVF?
Oh, it's hard to distill that into one point. One thing I wish I'd known, I think for me, just how much support is out there, because even though I do have a strong support network, as Stephanie said, there are times that you feel so isolated, so alone, and maybe speaking to strangers online doesn't work for you, but there are forums, there's professional care if you are able to access that. That's also an important point, because it isn't accessible to everybody. There are books, there are podcasts and films. Nowadays, so many resources, and something will resonate with you. And I think it helps. It gives you the courage to continue, especially when things get tough.
Absolutely. Stephanie, one thing you wish you had known?
I guess more than known is also a feeling of being able to advocate for myself and to be confident in that. I think many times, which now obviously when I think back, when you think back to it, you feel very embarrassed to ask the silly questions because you don't know what's going on. So I guess that is something that I would definitely, I would be like, okay, no, I would have more confidence in myself or in yourself, and ask the silly questions, because it's your body. It's you that's going to go through, that's going to suffer either positively or negatively. So that, yeah, just be brave, advocate for yourself, and be confident in what you don't know. And what you're about. Yeah. And
Dr. Renato, what's one thing that you wish that patients would know before they start an IVF process, whether it's successful or unsuccessful?
Yeah, as I started, what's coming to my head is just be kind to yourself. Just take that moment to be kind to yourself, and no matter what, if it's positive, if it's negative, if it's a short journey, if it's a long journey, just make sure that you are kind to yourself. And that will make the journey, whether long or short, easier, much easier.
Dr. Joaquim, parting words?
Well, I try that. I do my best, and I try hard that my patients know everything before starting. Yeah, really, I'm very talkative, and I talk a lot to everyone. And I think unless you're a fertility specialist, you have to ask the silly questions, and it's us that are specialists that have to answer everything. So even if they sound silly, they're not. So I really want the patients to know everything: success rates, everything you're going through, maybe the symptoms that you're expected to have, everything. So I really try that we talk about all that before starting.
Thanks so much for that. Any parting words from anyone else? Seetal? Stephanie? No? Okay. Well, I wanted to close us out. If no one has any other questions in the chat, again, thank you so much, Dr. Renato, Dr. Joaquim, Seetal, Stephanie, for being here. We really appreciate it. You can contact us afterwards, by the way, all of us here on the panel, to talk about your personal journey. And in fact, we want to invite you to understand that at Ovum, we really mean that we want to enable every single patient to become a parent if you so desire. So we believe so much in our mission that if you decide to cycle with us at Ovum Portugal, we will pay for your flights to Portugal, and you will have free monitoring and blood tests. So that means ultrasounds and blood work during your stimulation. This is typically a value of 360 pounds. We understand that there could have been fail cycles before, and it could have been very expensive, and we will do our best to take care of you, and we hope that we see you in Portugal. Thank you so much for joining, and if you have any other questions, you'll get an email at the end from Leslie letting you know how you can contact us, and we hope to see you in Portugal soon. That's all for now. Thank you.